Today, the greatest risk of global catastrophe doesn't look like this. Instead, it looks like this. If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war.
The clip that I just showed you is from early 2015, almost 5 years before the crisis that we are stuck in. But how was he so sure? During 2002 and 3, more than 8,000 people in 26 countries around the world contracted SARS. There were 774 reported deaths. And then came MERS-CoV, which causes Middle East Respiratory Syndrome. According to the World Health Organization, it emerged in September 2012 in Saudi Arabia. Since 2012, 27 countries have reported more than 2,400 MERS cases. Hence, SARS-CoV-2, which resulted in COVID-19, isn't the first one, but sure seems the most deadly. This new coronavirus appeared in Wuhan, China, in late December 2019, after health officials noticed an increase in phenomena cases with no known causes. These cases have since been linked to a market selling seafood and poultry. Though the virus likely evolved from an animal source, its exact source is unknown. Within a few months, SARS-CoV-2 has spread to hundreds of countries around the world after being transmitted through person-to-person contact. It's dangerous because it's transmitted easily from person to person whether or not the person is exhibiting symptoms. The primary symptoms of COVID-19 include cough, fever, shortness of breath, fatigue. Coronaviruses are zoonotic viruses. That means they commonly affect animals such as birds, bats, camels, and pigs. Coming further, may it be a conspiracy or a fact. 7,000 cases in Indonesia, 6,000 in Pakistan, 2,000 Bangladesh, and 500 coronavirus cases in Nigeria, out of which almost 2,700 have been recovered. The point trying to be made here is that these 4 countries with the highest Muslim population in the world having minimal cases even if added up. Now, based on this, you can either blame the Muslims for this epidemic as India chose to do, or you can put your mind to the right place and think that how, in comparison, is it that only a very little percentage of Muslim population around the world have contracted the coronavirus. Point number 1. Where the World Health Organization asks you to wash your hand after every now and then. It is an obligation for every Muslim by their religion to wash themselves, in other words, do wudu before every prayer, which has to be offered 5 times a day minimum. Another point. Throughout the history, women in Islam have been discriminated for covering themselves, especially their faces. Call it karma or God's doing. Even the people with no faith have now covered themselves in order to avoid catching the virus. The irony in that. After China, Italy was the next big target, having total of around 176,000 cases, followed up by United Kingdom, and then the current epidemic center, United States of America, where only in New York there are 236,732 registered cases. But it's safe to say that a country like United States will have quite enough resources and the ability to deal with this epidemic. Wrong. According to an estimate, there are only 62,188 full-featured mechanical ventilators and 98,000 devices other than the full-feature ventilators owned by the US acute care hospitals. Surely USA is trying to maintain the most efficient use of its limited resources, but sorry to say, the death toll has already reached 41,000. Even if the United States prevails as a great power, it cannot protect its security by acting alone, says Joseph Nye. But if we talk about other developing countries, it's still a strong possibility that the crisis may reach them soon as well. And if it's to happen, may God help them, because it can be said with certainty that they do not contain the resources to fight against COVID-19. Almost 5 months have passed. The world is still trying to find its way out. According to New York Times, It is the end of the world economy as we know it. The stock market collapsed, the schools and universities closed. Only imagine what were to happen if this situation prolongs. Poor people have already started dying by hunger. They no longer have the means of earning. Even if they go out during quarantine, there isn't any work available. What about the people who are trying to fight for their survival while living in a country with a very poor economy? Even their own government cannot support them for long. Now you know what kind of hell the people of Kashmir have been living in for the past 253 days. From 5th August 2019 till the present, 8 months and 10 days. Curfew, communication blockage, media blackout. I'm sorry, but you are still incapable of imagining what they have been facing thanks to India. Just hope that it wasn't any of our Kashmiri brothers or sisters that cursed the world to feel the pain that they have felt. Otherwise, this would be a living hell for us. I could go on and on about this, but to those whom it matters, will find a way and help them and ease their pain. Let me conclude this now. The world is surely in a dire difficulty. More than thousands jobless, countless dead. The graveyards no longer have any space to bury the dead. But open your eyes to the positivity as well. The world is seeing a positive benefit on the environment as a result of coronavirus outbreak. Satellite photos of China show an unprecedented drop in pollution. Worldwide greenhouse gas emissions are falling, and even the planet's rivers and bays are clearing up, including the famously murky canals of Venice. It's an environmental boon that decades of green activism could not achieve. But experts are warning not to call it a silver lining, saying things will no doubt return to normal, with pollution levels even returning with a vengeance, unless we permanently adopt some of the climate-friendly practices that we have accidentally embraced during the shutdown, working remotely being just one. From the time of Adam to till date, the majority problems and difficulties that we faced are our own doings, but it's still not too late to mend our ways. Help each other, avoid going out, isolate yourself if you see the symptoms in you. Do the right thing. Thank you.